My name is Lucas Eastaugh. I am a paediatric cardiologist. I work at the Royal Children's Hospital in Melbourne and work as a subspecialty area in paediatric cardiology called interventional cardiology. So congenital heart disease is a condition that affects either the heart or the major blood vessels of the child that they are born with. That condition may affect the heart or the major blood vessels and really affects the way that the blood flows through the heart, out to the lungs and around the rest of the body. There can be multiple different types of congenital heart disease. Some can be very minor and show no symptoms at all of their congenital heart disease, and other children can present really critically unwell shortly after birth or in the first few weeks or months of life. Only around 60% of the congenital heart disease that we see is actually picked up with fetal scans. There are some children and adolescents who present later on, and adults who can also present with congenital heart disease. When they go to visit their maternal child healthcare nurse or their GP at 6 weeks to have the routine baby check, they may note that the baby isn't growing properly, or they may ask the parents about symptoms. Older children tend to be more of an incidental pickup. The vast majority is still an unknown cause. Around 15% we do find there is a genetic cause. The maternal causes are extremely important. Things like infections that occur during the pregnancy, some medications that the mother is taking, or certain lifestyle habits like smoking are clearly associated with increased risk of congenital heart disease. There are certainly certain types of medications and infections that may trigger those things, but very few circumstances where you can prevent a congenital heart disease occurring. So the most common form of congenital heart disease that we would see is a condition called a ventricular septal defect, and that's a hole in the wall of the heart that separates the two pumping chambers, or ventricles as they're technically known. There are other conditions that affect the upper chambers of the heart called the atria, where there's a hole between those two chambers, and that's called an atrial septal defect. One of the ones we see present is a condition called coarctation of the aorta, and that's a severe narrowing in the major blood vessel that pumps the blood around our body. We see conditions where the chambers of the heart don't form properly. So one that people hear about is called hyperplastic left heart. The management of congenital heart disease is really very variable. Most forms of congenital heart disease may require some intervention at some stage. Children who have more critical forms of heart disease and need surgeries within the first year of life may again only need a one-off surgery. Other children may need multiple surgeries staged over a period of time. Other children have what we term heart conditions where we can't completely correct them, and we call some of those conditions, as difficult as they sound, we call them palliative procedures, where what we're aiming to do is restore and improve the child's quality of life. But they may require multiple procedures, and their heart is never fully or completely repaired. And we really go on a journey with most of these patients through all of their life, at least when they spend it in a paediatric institution. We know that a lot of these children need support with other health professionals from other specialties if they have other organs that are involved in their medical condition, but also to help with their day-to-day living and their activities of daily living, their participation in sports. There have been significant advances in cardiac surgery and support and what we're able to achieve. Still, there is a requirement for open heart surgery in terms of children with congenital heart disease. But more and more there are advances in less invasive techniques such as cardiac catheterization procedures to alleviate their symptoms and help them lead a full and normal life. It is exceedingly important that families who get such a difficult diagnosis as congenital heart disease realise that they'll be on a journey with the medical profession for their entire life. While the diagnosis can be very overwhelming initially, I think it's really important to arm yourself with the information and the understanding, and the best people to provide that are usually the health professionals that you meet, groups such as Heart Kids and other advocacy groups who will actually provide up-to-date and clear information for parent groups, joining with other parent groups. So there are lots of support networks through various social media sites, etc., where families can connect and go on the journey together. One of the most important things that I talk to families about when they have a new diagnosis of a congenital heart disease is to really ensure that they arm themselves with information from trusted resources. I think there is a lot of information that parents can search up on Google and search engines and really cause themselves sometimes more harm than good. First, talk to the primary care physician or your cardiologist to ask for guidance in those circumstances as to where the best information can come from and how you can be best supported. The vast majority of children with congenital heart disease live well into adult life, and the vast majority with the less severe forms of congenital heart disease have virtually no signs or symptoms at all. And those patients who have the more severe forms of heart conditions are the ones that we can very, very well support and set up for a fulfilling life as well. But it is also important, I think, as well to understand some of the challenges that they may face. One of the best advocacy groups we have in Australia is Heart Kids, and they do exceedingly important work in supporting families with congenital heart disease or a diagnosis of childhood onset heart disease. They have amazing amounts of information and really a fantastic group who engage health professionals in producing the information that is available to families, but also supporting families in a different way to help them get through their journey with congenital heart disease. So certainly any family that is confronted with a diagnosis of congenital heart disease, we would encourage them to touch base and engage with Heart Kids.